Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about antisocial personality disorder. So let's get into it. So these first things I want to point out, these words I'm sure we've heard of, psychopath and sociopath. I'm sure we've heard them on like crime shows and things like that, and they've been used kind of interchangeably. They are very different things. And actually, neither one of them is a medical diagnosis. The actual diagnosis for these patients is called antisocial personality disorder. So that's what this video is about. It used to be called sociopathy. So most people who have antisocial personality disorder are sociopaths, okay? So what's the difference? A sociopath is somebody who has a weak moral compass. They know the difference between right and wrong, but they don't really care. So a sociopath does have a conscience, okay? They do have a conscience. They know the difference between right and wrong, but it doesn't affect their behavior like it would other people, okay? They're still going to choose the wrong thing because they don't care about the consequences. These patients are capable of forming attachments to others in relationships. It is challenging for them to do that, but they can. Where the contrast here, psychopaths, no conscience, okay? So they don't know right and wrong, or they don't care about right and wrong, so there's no conscience there. They mimic emotion, so they cannot experience emotion, so what they do is they fake it, okay? So they pretend to feel emotions like other people. And then this can be considered a severe form of anti-personality disorder. So this gets a little confusing when it comes to the diagnosing of these things. So antisocial personality disorder is a diagnostic personality disorder in the DSM-5. So you can be diagnosed with this, okay? Psychopathy isn't in that, okay? So to diagnose somebody as a psychopath, there is a separate questionnaire that is not related, and we'll talk about that. So diagnosing these things can be challenging for our doctors. And when it comes to causes, sometimes they think it might be related to an imbalance of serotonin. Remember, serotonin is what helps alter our mood. Childhood trauma or abuse. Drugs and alcohol. I think the statistic I read was like 50% of people with antisocial personality disorder also abuse drugs and alcohol. So they're very closely related. And this isn't a cause but a risk factor, being a man. So men are more likely to have antisocial personality disorder than women. Some signs and symptoms our patient might present with include disregard for right and wrong, lying or generalized deceitfulness, using charm to manipulate others. So that one's special because when you hear that word antisocial, you kind of think about somebody that's withdrawn and they don't really interact with others, and maybe they're like, grouchy or whatever. And there definitely can be people like that, but sometimes they will be very charming and funny and charismatic because they're using that to get what they want. So they're manipulating, lying, whatever, to people to get the things that they want. Arrogance, this self-importance. I'm the most important person in this entire room or this entire world, so that's why the rules don't apply to me. They can be impulsive and take unnecessary risks, which could be a danger to their physical health. Hostility, aggression. Aggression towards people, but also animals. This might be something you're familiar with. You've probably heard of that. People who harm animals, right? We always think like, God, what's wrong with you, right? When somebody harms animals. That could be a big sign that they have antisocial personality disorder. And then they're more likely to break the law. The statistics I read, it's less than 1% of the population has antisocial personality disorder, but around 25% of people in jail have it, which is just crazy to me. And a lot of people are actually diagnosed with this in jail. So they didn't know they had it before, or they weren't officially diagnosed with anything, and that's how they come to get diagnosed after they get arrested. So they are more likely to break the law. These patients often do not seek out help for this disorder because they don't feel that they need help, which is why a lot of them are diagnosed during evaluations in jail. Other times that they might get diagnosed is when they're seeking help for other things like anxiety. So maybe they've come to the doctor to get something for anxiety, and then doctor does their evaluation and says, oh, you have antisocial personality disorder. So they might be seeking help from other things. So how was it diagnosed? By the signs and symptoms in the DSM-5. So the way we can remember those criteria, what we're looking for, is the word corrupt. So C, cannot conform to the law. O, obligations ignored. So this affects their personal life and their work life. R, reckless disregard for safety, the safety of others and their own personal safety. So this is like that risk-taking behavior. Remorseless, so they don't feel bad about doing bad things. Underhanded, so deceitful, lying, or using charm. P, planning insufficient, so impulsive, that impulsive nature. And then T is for temper. So they have a hot temper. They're very aggressive and easily agitated. And then I wanted to add, specifically for the psychopath, because remember I said it's different. You can't be diagnosed as a psychopath using the DSM-5. There's something special. It's called the Hare Psychopathy Checklist. It has like 20 different characteristics in it. This needs to be done by a trained clinician who knows what they're doing to do this. And if they score high on that, right, that's how we know, okay, they are a psychopath. What are some things we can do to help these patients? Teach them strategies to help control their anger. If they are abusing substances, helping with that, helping them to get off those substances safely. Teaching coping strategies. Therapy, of course, lifelong therapy, that's going to be the big one. And then sometimes medications. So there is no specific class of medication used for antisocial personality disorder, but we can use other types of meds that might help. So we can use mood stabilizers or antipsychotics in some patients. These can be seen as helpful, especially if our patients are really angry and aggressive. This might help with that. And it's important to know these things when it comes to our patients because we have to think safety. Patient safety is number one, right? All the time. These patients are more likely to die by violent means. So suicide rates are high, homicide, or accidents. They get into accidents because of that impulsive, risk-taking nature. So safety is key for these patients when you're caring for these patients. And then we do need to recognize this is not something that has a cure, okay? So this is a chronic illness. It's a chronic disorder, but it may decrease with age. So those signs and symptoms may start to subside as they get older, and typically older patients who have this are also less likely to involve themselves in illegal activities. So that's a good thing. That's a good thing. But our key point is safety, okay? When you think about this, that's what you want to think about, is safety for this patient, getting them coping strategies, and then therapy, right? That's the big stuff when it comes to this patient population. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know, and if not, I'll see you on the next one.